Trauma can have a profound and lasting impact on our lives, but the path to healing is within reach. In this video, we will explore the most effective types of therapy for trauma, offering insights and guidance for those seeking to reclaim their well-being. The aftermath of a traumatic experience can permeate every aspect of our existence, affecting our emotions, relationships, and overall sense of self. However, numerous therapeutic approaches have been developed to address these deep wounds and support the healing process. Throughout this video, we will delve into a variety of proven therapeutic techniques tailored specifically for trauma. We will examine the benefits of cognitive processing therapy, prolonged exposure therapy, trauma-focused cognitive behavioral therapy, EMDR therapy, somatic therapies, and psychodynamic therapy. Additionally, we will explore other valuable modalities like hypnotherapy, narrative therapy, internal family systems therapy, art and music therapy, and inner child work. By understanding the unique strengths and characteristics of each therapeutic approach, we can empower ourselves with the knowledge needed to choose the right path toward healing. While there is no one-size-fits-all solution, the journey to recovery begins with exploring the options available. If you find this information helpful and want to continue learning about topics related to trauma and mental health, we encourage you to subscribe to our channel. By subscribing, you'll gain access to a wealth of insightful content designed to support your healing journey and provide ongoing guidance and inspiration. Remember, finding the best therapy for trauma is a highly individualized process, and support is available every step of the way. So, let's embark on this transformative exploration together as we uncover the best types of therapy for trauma and discover the remarkable resilience of the human spirit. Don't forget to subscribe and join our community of healing and growth. In what ways can therapy assist individuals in coping with trauma? Trauma can stem from various sources, including singular incidents like accidents or assaults, as well as recurring experiences such as abusive relationships or childhood neglect. Complex trauma, often resulting from prolonged events during childhood, can significantly impact one's adult life. Therapeutic interventions play a crucial role in the healing process by aiding individuals in integrating and comprehending their traumatic experiences. While the memories of the trauma persist, therapy can gradually diminish their hold on emotions and overall well-being. Lisa Curtis, a licensed clinical social worker in New York, emphasizes the value of therapy in normalizing individuals' responses to their traumatic encounters. Therapy not only equips them with new coping mechanisms to manage their emotions and reactions but also provides a supportive framework and education regarding the specific events they endured. When addressing trauma and post-traumatic stress disorder, PTSD, numerous evidence-based practices, EBPs, have demonstrated their effectiveness in targeted populations. These well-established interventions serve as a foundation for recommended therapeutic approaches, although it is worth noting that not all therapies endorsed are classified as EBPs. Cognitive processing therapy, CPT, was developed by Patricia Reesick, PhD, ABPP, with the intention of providing a treatment specifically designed for post-traumatic stress disorder, PTSD, symptoms. Its primary objective is to assist individuals who find themselves trapped in repetitive and distressing thoughts related to their traumatic experiences. During CPT, a therapist will guide you in the process of identifying and challenging unhelpful beliefs that contribute to your feeling of being stuck in relation to the trauma. By examining and restructuring these beliefs, the aim is to bring about a shift in your understanding and perspective of the events, ultimately alleviating the negative impact they have on your life. In a comprehensive review conducted in 2018, it was concluded that based on the available evidence, CPT proves to be an effective treatment for PTSD, yielding long-lasting benefits across a range of outcomes. Recognizing its effectiveness, the American Psychological Association (APA) strongly recommends CPT as a therapeutic approach for individuals diagnosed with PTSD. It is worth noting that while CPT has demonstrated its efficacy, each individual's response to therapy may vary. Therefore, it is essential to consult with a qualified mental health professional to determine the most suitable treatment approach for your specific needs. Prolonged exposure therapy, as its name implies, is a behavioral treatment approach for post-traumatic stress disorder, PTSD, that involves directly facing and confronting the source of fear associated with the traumatic event. The prominent symptom of avoidance commonly seen in PTSD is specifically targeted in this therapy. In the course of therapy, individuals are taught techniques to regulate their breathing while engaging in discussions about their traumatic experience. Gradually, they are guided to confront their fears in real-life situations. For instance, someone who has survived a sexual assault may be encouraged to revisit the location where the assault took place, enabling them to recognize that the trauma is no longer ongoing and that they are now in a safe environment. Abigail Lev, PsyD, a licensed clinical behavioral therapist and author, emphasizes that avoiding the feelings, thoughts, sensations, memories, and images associated with trauma can exacerbate PTSD symptoms. Therefore, the core aspect of trauma treatment lies in exposing individuals to these elements connected to their traumatic experience. This exposure facilitates the process of desensitization and ultimately promotes healing. According to the American Psychological Association (APA), prolonged exposure therapy is highly recommended as an effective treatment for PTSD. It's important to note that prolonged exposure therapy is designed to be conducted under the guidance of a trained and licensed therapist. The therapist plays a crucial role in providing a safe and supportive environment for individuals undergoing this treatment, ensuring their well-being throughout the process. Additionally, therapy sessions may incorporate various techniques, such as imaginal exposure, revisiting traumatic memories in imagination, and in vivo exposure, confronting real-world situations associated with trauma, tailored to meet the specific needs and comfort level of each individual. Trauma-focused cognitive behavioral therapy, TFCBT, is a therapeutic approach primarily designed for children and adolescents who have experienced trauma. This form of cognitive behavioral treatment focuses on addressing the unique needs of young individuals dealing with traumatic experiences. The primary objective of TFCBT is to assist children in recognizing and challenging false beliefs, such as misplaced blame for the abuse they have endured. Through this therapy, children are guided towards correcting unhealthy behavior patterns and acquiring new coping strategies. These strategies may include techniques for self-soothing and effectively expressing their emotions. Importantly, TFCBT also involves the active participation of parents or caregivers, recognizing the crucial role they play in the child's healing process. A comprehensive review conducted in 2014 concluded that TFCBT demonstrated effectiveness in reducing symptoms of post-traumatic stress disorder, PTSD, among certain children. The American Psychological Association (APA) strongly recommends various forms of cognitive behavioral therapy, CBT, including TFCBT, as a preferred treatment approach for individuals with PTSD. It is important to note that TFCBT's positive outcomes and the APA's endorsement of CBT for PTSD highlight the potential benefits of this therapeutic modality for trauma recovery in children and adolescents. However, the selection of an appropriate treatment approach should always be tailored to the specific needs of the individual and considered in consultation with a qualified mental health professional. Eye movement desensitization and reprocessing (EMDR Therapy), developed by psychologist Dr. Francine Shapiro in 1987, is an innovative approach to trauma treatment. Unlike traditional talk therapy, EMDR focuses on processing and releasing traumatic memories through eye movements, offering a unique therapeutic experience. During an EMDR session, the therapist guides you to concentrate on a specific aspect of the traumatic event while simultaneously engaging in bilateral stimulation. This stimulation can take the form of the therapist's hand moving back and forth or rhythmic tapping. The primary objective of EMDR is to facilitate the reprocessing of memories that were not fully processed at the time due to overwhelming stress. By stimulating both sides of the brain, EMDR aims to release the emotional and cognitive burdens associated with the trauma, providing relief from nightmares, flashbacks, and triggers. One notable advantage of EMDR is its potential for accelerated results compared to traditional talk therapy for some individuals. A study conducted by Shapiro in 2014 reported that 80% to 90% of participants experienced positive outcomes within the first 3 sessions. Additionally, a 2017 review found EMDR to be equally effective as cognitive behavioral therapy, CBT. It is important to note that EMDR is typically more effective for single-event traumas and may have limited efficacy for complex trauma or complex post-traumatic stress disorder, PTSD. Each person's response to therapy may vary based on their unique circumstances and needs. According to the American Psychological Association, APA, EMDR therapy is conditionally recommended as a treatment for PTSD, highlighting its potential as a valuable therapeutic option in trauma recovery. Somatic therapies, also known as body-oriented therapies, recognize that traumatic memories can reside not only in the mind but also in the body. These approaches emphasize the profound impact of emotions on physical sensations. In the context of trauma, emotions can unexpectedly resurface when triggered or when confronted with reminders of past traumatic experiences. The primary goal of somatic therapy is to facilitate the release of pent-up trauma, which can alleviate symptoms of mental distress and chronic pain. This therapeutic modality involves techniques such as developing body awareness and grounding oneself in the present moment and bodily sensations. A study conducted in 2017 highlighted the effectiveness of somatic experiencing, a specific somatic therapy approach that involves verbal processing of past traumas while exploring the physical responses and sensations within the body. The findings indicated positive outcomes in the treatment of post-traumatic stress disorder, PTSD. Psychodynamic therapy, on the other hand, focuses on understanding how past experiences have shaped an individual's current emotions, behaviors, and patterns of relating to others. Within the framework of psychodynamic therapy, the aim is to bring to light the unconscious motivations that influence one's behavior. Through this therapeutic approach, the therapist helps individuals comprehend the ways in which early childhood experiences, family dynamics, and present relationships, often shaped by traumatic events, impact their current coping mechanisms and belief systems about the world. A review conducted in 2008 demonstrated that incorporating psychodynamic approaches into trauma therapy can lead to several positive outcomes, including enhanced self-esteem, a shift towards more adaptive coping strategies, a reduction in maladaptive coping methods, improved relationships, and better overall social functioning. By integrating somatic therapies and psychodynamic therapy into trauma treatment, individuals gain a comprehensive approach that addresses both the physical and psychological aspects of their traumatic experiences, fostering holistic healing and personal growth. In addition to the previously mentioned therapeutic techniques, trauma therapists may employ various other approaches to aid in the healing process. One such technique is accelerated resolution therapy, ART, recognized by the Substance Abuse and Mental Health Services Administration, SAMHSA, as an evidence-based treatment for trauma-related disorders. ART aims to expedite relief from trauma by reprogramming how the brain stores traumatic memories in a condensed timeframe of 1 to 3 sessions. It incorporates elements from other techniques such as EMDR. Hypnotherapy serves as a popular alternative for individuals who may have struggled with other forms of therapy. Through hypnotherapy, a therapist guides the individual into a trance-like state where they remain awake and aware but relaxed, allowing them to block out distractions. The therapist then works to diminish the emotional attachment to the traumatic event. Hypnotherapy can bring subconscious fears, thoughts, and experiences to a conscious level, releasing the emotional grip of trauma and replacing it with functional thinking and mental patterns. Some research suggests that hypnotherapy may help reduce symptoms of PTSD. Narrative therapy is a relatively newer treatment approach that focuses on helping individuals reauthor their stories, giving meaning to their experiences and shaping their self-perception and worldview. By challenging negative beliefs and reframing the narrative surrounding the traumatic event, individuals can diminish the emotional hold that trauma has on them. This technique has shown promise in addressing various mental health issues and is conditionally recommended by the American Psychological Association (APA) as a treatment for PTSD. While the therapeutic techniques discussed earlier have received significant research attention, it's essential to recognize that trauma therapists may draw upon a range of approaches to cater to the unique needs and preferences of each individual. By embracing a diverse toolkit of therapeutic methods, therapists can provide comprehensive and personalized care for those on their journey to healing from trauma. Internal Family Systems Therapy, developed by therapist and academic Richard Schwartz, Ph.D., is a form of talk therapy that operates on the premise that individuals possess various parts within their personality, each with distinct characteristics. These parts are unified by the self, representing the core consciousness. Similar to a family unit, these parts collectively strive for the well-being of the self. During therapy sessions, the therapist facilitates an exploration of these different parts, recognizing that some may bear a greater burden of trauma than others. The goal is to foster an understanding of why certain parts are in distress and to cultivate compassion in addressing their needs rather than disregarding or suppressing them. In addition to internal family systems therapy, art and music therapy have shown promise in promoting mental health and supporting trauma recovery. Art therapy encompasses a broad range of expressive modalities such as dance, drama, music, writing, and various creative art forms. Art therapy can be particularly beneficial in trauma therapy as it taps into the subconscious mind, allowing for the effortless revelation of fearful patterns and suppressed emotions. Through the process of art creation, individuals may uncover and process deep-seated emotions and fears they may not have been consciously aware of. On the other hand, music therapy focuses on grounding individuals by engaging them in songwriting or composing music as a means of creating affirmations and regulating thoughts and emotions. Musical improvisation, in particular, can facilitate nonverbal exploration of traumatic experiences, offering an avenue for expression when verbal communication may be challenging during traumatic flashbacks. It's important to note that both internal family systems therapy and art music therapy can be valuable components of a comprehensive approach to trauma treatment, offering unique avenues for self-exploration, healing, and growth. As we come to the end of our exploration into the best types of therapy for trauma, we hope that this video has provided you with valuable insights and guidance on your journey toward healing and resilience. Remember, healing from trauma is a deeply personal process, and finding the right therapy that resonates with you is essential. We encourage you to explore the various therapeutic approaches we discussed and seek professional support to help you along the way. If you found this video informative and would like to continue learning about topics related to trauma, mental health, and personal growth, we invite you to subscribe to our channel. By subscribing, you'll stay updated with our latest content and join a community of individuals committed to their well-being. Thank you for watching, and we genuinely appreciate your support. If you have any questions or comments, please feel free to leave them in the comment section below. Take care of yourself, be gentle with your healing process, and remember that you're not alone on this journey. Until next time, stay strong, stay resilient, and keep prioritizing your well-being. Subscribe to our channel, and together, let's continue to navigate the path toward healing.